Welcome to another session of basic science class. Today we'll be treating a very interesting topic, child care and health. Last video on basic science we talk about family traits, where we talk about how different physical characteristics can be passed down. Physical features like their nose shape, their skin color, their blood group, and so on can be passed down from parents to their offspring. That was what we discussed in our last video, but today we'll be talking about child care and health. So to understand this particular topic better, we'll be dividing it into three segments, three periods of care. We have the antenatal care, we have the intrapartum care. So these are the divisions for us to understand this topic better. And lastly, we have postnatal care. This is the three different categories that we are going to be talking about. We're going to start with antenatal care. Have you heard of antenatal care before? Maybe from your parents or from your neighbor or from your schools or from anywhere. Have you heard about antenatal care? When we talk about antenatal care is the type of care given to the mother and the unborn baby, or the care given before the birth of the baby. Antenatal care is the care given to the mother and the baby before the delivery. That is the meaning of antenatal. Before a child is delivered, you have to go to the hospital to see doctors, to receive treatment, to make sure the baby is in good condition, to make sure you, the mother, is also in good condition before the due date of delivery. That is the meaning of antenatal. What are the things that are involved in antenatal care? Number one is educating the expectant mother on how to preserve her pregnancy. Preserving pregnancy. They are going to educate you on how you can protect and preserve your pregnancy to avoid any harm. That is the first thing they teach us how to do when you start antenatal. Okay, let's move to the next page without wasting time. Another important thing that is involved in antenatal care is medical care of the pregnant woman. The doctors make sure you are in good medical condition to give birth to the baby. They will check if there are no complications, if there won't be any problem while delivering your baby. That is another important aspect of antenatal care. Another thing that is very important during antenatal care is preparation for the baby's arrival. Preparation for the baby's arrival. This is the aspect where the mother has to prepare for the baby's arrival by buying baby things, taking care of the baby, checking if the baby is breathing, if the baby is in good condition, taking all that is needed for delivery, taking it very important, buying them, keeping them, and make sure everything is available for the delivery date. Another important aspect is examining the baby in the womb. As a mother, you have to always examine the position of your baby in the womb. The mother has to know if the baby is breathing, if the baby is kicking, if the baby is in the correct position, and this can only be confirmed by doctor. That is why antenatal care is very important. The mother might not know if the baby is in good condition or if the baby is breathing, but when you go to the hospital for antenatal care, the doctor will be able to tell the expecting mother that okay, this is how your baby is in good condition, there is no problem with your baby. So that is the reason why antenatal care is very important in child care and health, so that by the time this baby is giving birth to, the baby will not have any problem or any illness that he or she is battling with. So that is another reason why we must take our antenatal care very, very serious. Another reason why antenatal care is important is examination of the pregnant woman. This is another important aspect of antenatal care. When the baby is in good condition, the mother that is giving birth to the baby also have to be in good condition. So the doctor has to check if the mother of the baby is medically okay, if she can give birth to the baby or now, if there is going to be no complications while the mother is giving birth to the baby. So this is to ensure that both the mother and the unborn child, they are healthy, so that when the date of delivery comes, there won't be any problem with the mother and the child. So as the doctors are examining the baby in the womb, they also have to examine the pregnant woman, so that both can come out hale and healthy from delivery. So this is very, 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 very important. So that is why we have to always go for antenatal when the mother is pregnant. When the mother is pregnant, she must not take the antenatal care with unseriousness. The mother have to go to the hospital from time to time to make sure she is healthy and also the baby is healthy. So what is the importance of antenatal care? We have talked about the processes or the things involved in antenatal care. Now we want to look at the reason why antenatal care is very important. Number one is prevention of complication during pregnancy. So this is to make sure that the mother do not have any problem when she is giving birth to the baby. So that is the reason why antenatal care is very, very important, to make sure the mother is in good condition before giving birth to the baby. Another importance of antenatal care is treatment of existing ill health. This is also when the mother is pregnant before delivery. The doctor have to check if there is any illness that needs to be treated before the baby comes to the world. There are mothers that have infections, that have problems, that have one illness or the other that can affect the birth of the baby. So the doctors are responsible for the examination of the mother to make sure the mother is in good condition, the mother do not have any illness that can affect the birth of the baby. So this is another reason why antenatal care is important. If the mother have any problem, maybe there's one illness she is battling with that can cause problem for her when she's giving birth to the baby, the doctor will notify the mother immediately, and how she can fight the illnesses or how she can overcome the illness so that the baby will be given birth to without any complications. So that is another reason why a pregnant mother must go for antenatal. That is the importance of going for antenatal. The last but not the least importance that we'll be talking about here is constant supervision of the expectant mother. We have talked about this. Antenatal care is very important for a pregnant mother because it will allow the doctor to constantly examine the mother, because illnesses or sickness or any complication can arise anytime in the mother. So when the doctor check and they are sure that the mother is in good condition, they will keep giving her treatment to make sure there is no further complication. So the mother must keep going to the hospital to make sure that the baby is in good condition and there is no problem with the baby when the mother is giving birth. So I hope you understand today's lesson and I hope you enjoy the class. So before I go, let me write the last point here. I've explained this particular point and I hope you understand today's lesson. If you have any question or you have a topic that you want us to teach or explain in basic science, you can drop that in the comment section. I hope you enjoyed the class. See you in our next video. Bye bye.